Hello, everyone. Today we are going to analyze the Sudan situation related to a hidden humanitarian crisis. The interconnectedness of our world has never been so apparent, nor the urgency to resist the many forces that fuel inequality, oppression, and violence. Sudan is suffering violence, causing a diaspora of migrants, refugees, and internally displaced people. Humanitarian crises, including man-made conflicts such as this hidden situation in Sudan, cause suffering and affect human dignity. These humanitarian crises should be tackled with integral measures, and our commitment as a Catholic peace movement is to promote reflection and action. Solidarity, education, and advocacy are in the front of what Pax Christi International have done and continue doing for these 80 years. Humanitarian assistance is crucial in the conflict-torn Sudan to address widespread hunger, disease, and lack of basic services caused by this prolonged and silent conflict in Sudan and all the consequences, including mass displacement. But it should be accompanied by an integral approach to protect, to prevent further outbreaks, to heal, and to provide stability in the country. The humanitarian crisis should be tackled by addressing immediate needs, by preventing further crises, and by promoting stability and long-term solutions. So here we are to listen, to reflect, and to move to action. The first humanitarian message should be cease the violence against Sudanese people, especially those more vulnerable, women, children, forcibly recruited or abused. Their dignity should be respected, restored, and protected. A second message should be those who have been forced to abandon their home have the power and the right to determine where they live and the opportunity to thrive in society. Today, we will be listening from our friends, women and men, those of very young, the way that the Sudanese people are struggling with the situation. Let's reflect on the way that together with the international community, together faith organizations and bodies could be support this Sudanese work for dignity and for a future and for a present. So there should be in the situation with some support. So before we begin, the chat is open. Please feel free to introduce yourself by sharing your full name, organization if applicable, and the city or country you are joining from. It is always wonderful to see where everyone is connected from. Once the webinar starts, we will close the chat. And of course, there will be the questions and answer place for you to interact with the presenters. Let me introduce you today, Dr. Mawa Abdelbagi Osman Mohamed. Mawa is a young lady, very smart, a sociologist and research fellow at the University of Milano Bicocca. Her research focuses on gender, displacement, conflict, and social resilience in the sub-Saharan Africa, with a particular emphasis on Sudan. She has conducted ethnographic fieldwork in Darfur's Abu Shouk camp, analyzing women's solidarity networks and grassroots peace-building efforts. Her current work explores education during conflict, youth agency, and gendered peace processes. Dr. Mohamed's work bridges academic research with real-world insight to support communities affected by war and displacement. Thank you for coming to this webinar. Thank you, Dr. Mawa. It's a pleasure to have you leading this conversation. The floor is yours.
Thank you, Martinez. Thank you for introducing me. And thank you again for Pax Christian for doing this amazing work to raise the awareness about what happened to Sudan. Sudan, what we call it like a forgotten war. Like it's been forgetting, had been left behind in the chaos of what's happening now. Like the humanitarian situation in Sudan is catastrophic. The conflict had devastated the infrastructures and left people without basic needs. Education collapsed there is thousands of the kids they're outside of the educations. The kids who are gonna be the next generations who are gonna lead the country. Now they cannot be educated because there is no access to school. Health services are absent across much of the country, while outbreak of diseases such like cholera, malaria, and so on. And this crisis is combined by environmental disaster. The country sees annual flood, which displaces thousands and claim deaths, and authorities have little plan or respond capability. Now, as the war devastated, the country even face more environmental disaster. This disaster have even more impacted the country. On September 2nd in 2025, for instance, a landslide caused by heavy rain destroyed an entire village in Darfur, killing at least 1,000 people and just one survivor. These people were already displaced from Darfur. They were looking for what we call it Amalaz Amin, or what is being called safe haven. They run from war to find death just in a different place. So the people of Sudan, they are not just facing conflict. They are facing much of disaster. They're facing diseases, floods, and so on. So today, we will give a glimpse. We will give some stories about what happened in Sudan. We're gonna show you what's happening from diseases, also the work of the Sudanese people. We're gonna listen of an experience from the land. The people who are gonna talk now are the youth of the Sudan, the future of Sudan, who are gonna build Sudan, the next Sudan that we are dreaming of. We have Dr. Mujahid Halali. Dr. Mujahid, who has been known by his work in the camp. He did an amazing work. We have Dr. Abrar. She also worked with the community. And we have also Saleh. Saleh also wrote many research on what the user is doing, the emergency room, and so on. So today we have an amazing speakers that are working really hard on Sudan. And our first speaker is Dr. Mujahid Halali. Dr. Mujahid Halali is a Sudanese physician and humanitarian activist with extensive experience in clinical care, humanitarian relief, and public health, leadership in conflict affected setting. He has provided direct medical care to 1,000 of displaced people, treating up 100 patients daily while managing an emergency room sustained through community lead fundraising for over 5 months in a camp setting. Behind his clinical practice, Dr. Halali has co-founded and led several initiatives, including the Lead Read Initiative in Al-Mariha Research Institute. He has also collaborated with organizations such as UNDP, Sudan, and Regional Health Network. He also holds a Bachelor of Medicine in Surgery and from Sinar University, and he is pursuing an Executive Master in Public Health Emergency Management with International Academy of Public Health in collaborations with the University of Minneapolis. His research and advocacy focus on emergency medicine, public health emergency, and humanitarian response. And he has presented an institutional form, including TUFH in 2023. So I'm happy to introduce Dr. Mujahid. We are so proud with his work, what he did in the camp, how he helped the community inside the camp. So, Dr. Mujahid, the floor is yours. The floor is yours. You can start.
Okay. Thank you, Ma'wa. Thank you, Dr. Ma'wa, and good morning, good afternoon, everyone. It is truly an honor to be with you today. I want to take you directly inside the camps in Sudan to share both the humanitarian situations and my personal experience as doctors and humanitarian activist and also as displaced persons, my aim is not only to describe the challenges we have people in the camp, but also to reflect on the lessons that this crisis can teach us of all. So when the war is began in Sudan in 2023, Sudan had the world's largest displacement crisis with more than 12 million people forced to leave their homes. The camps are overcrowded, shelters are inadequate, and there are a major shortage of food, clean water, and sanitation. Health challenges are severe, high level of malnutrition among children and pregnant women, frequent outbreak of cholera and malaria, and very limited access to maternal and child health care. During these days, actually, the Sudanese people in everywhere, they struggle and suffer from the dengue fevers and others outbreak. These are not just statistics or number. They are daily realities for families who are simply trying to survive. So related to humanitarian situations in the camp, beyond the physical health, there is the psychological challenges and increase day by day. Many people suffer from trauma, depressions, and even suicide attempts. Unfortunately, before 2 months here in Kampala, because now I'm refugee in Kampala, there is a young guy, unfortunately, he succeeded to end his life by very bad way because the situations has going through it. And unfortunately, with limited humanitarian access, much of the burden fall on the local volunteers and community initiatives. It was in this context that I began my working in the camp alongside with others who were trying to fill this gap. So next slide, please. My story, actually, or my displacement story, began after the fall of Wad Madani, the second largest city in Sudan, and later the Sinja in Sinai state, which is my homeland. Like thousands of others, I had to flee for safety. I eventually reached after 10 days looking for my family from the village to another village. I succeed to reach Al Tabalain in a White Nile states, where the camps were already overwhelmed with a lot of families were living in the insecurity and severe shortage. While serving others, I was also carrying the worry of my family and and also as my roles as physicians and displaced persons shape the way I experience delivered to humanitarian care for other people. Next, please. I want also all these pictures included in my presentation is for mines. I had taking my with my phone in a very difficult situations I going through, so that maybe sometimes it's bring for me a memory and affects my speech. So I apologize for that. So my journey is my own journey of displacements began, as I said, from Medani, and it take long time, long difficulties and many challenges actually. Sorry. Life in the camp was extremely difficult. Overcrowding means that many families has no tents and sleep in the opens. They receive rains and even sunny days without anything to protect. Food shortage contributing to widespread malnutrition among children. Poor sanitation cause repeated outbreak of diarrheal disease, especially cholera, and the mental health situations was alarming. I personally witnessed there are 3 to 4 suicide attempts each month in the camp, and security risks were constant. More than 20 civilian people were killed near the camp and bring them to my clinic in the camp in school, including a fellow doctors from a near village, unfortunately. This is a very dark memory, actually. And the conditions under this, it was every day it's being more challenging. My role in the camp, next please. My role in the camp as a doctor, I conducted daily consultations. Often, I treated up to 100 patients per day during the outbreaks of cholera and malaria and even dengue fever. And over the time, I provide care for more than 5,000 displaced people. My focus was on child health, maternal emergencies, and infectious disease, and also for treating those victims has been injured from direct conflict or from the war. Because my clinic it's near to conflict zones. For that, the people, this is the first point they came to my area or to my clinic. Also, I tried to provide the basic psychological support when needed. And unfortunately, medicine is not enough. So I had to improve or to, with the limited supplies, to provide these health services, basic health services actually with a very difficult situations. Despite of these challenges, this work was essential because other many people, they don't have limited to access. There is many schools in that area. There are no doctors, there are no medical supplies. For that, people, they come from far distance, from a far distance to my clinics. Next, please. That's make me to think deeply. Just to provide to provide clinical services is not enough actually, because people are starving, people dying from because there are no food, and there is another challenge. That's make me to launch my initiative to support families, which is created the shelters and food, which we operated the kitchen for 1,500 families over more than 6 months. Unfortunately, after 6 months, when I left that place, after a week, there is conflicts being in that area, and unfortunately, people from those child now they're sitting in the pictures. Unfortunately, they lost more than 50 people. Most of them from my family friends, more than 8 persons they lost from that village where I was being there, which is very very sad situations. Um, we provide more than in my initiative, I provide like more than 60 tents for over than 90 individuals, 900 or 900 individuals, because very extended family and people there don't have anything. And unfortunately, that's in the fall season, including 35 pregnant women to support their livelihoods. We distributed also small grants ranging from 50 to 200,000 Sudanese pounds, helping about 25 to 30 small business recover. That's which help the families there, they can assist themselves or to bring food and to access, for example, the basic needs, and people because they lost everything. Second, please. The challenge were enormous. We had a severe shortage of medicine, even IV fluid not there, and the simple medical supplies and emergency medical medicines there where is lost. I often had to sometimes use like just 10 millimeters, 100 millimeters for those people they have hypoglycemic, because uh, there are no food and there are a number of hypoglycemia due to hungry and malnutrition. It's a lot, and also I have a little amount of that. Just I use like just when a patient administers like a little amount of fluid till the patients get like recover or feel is good, and I return to another. With no internet inside the camp, and even in all the states, there was no internet, there no electricity. I walked long distance to connect and secure donations. Security like threats were constant, and this is obstacle remind daily of how fragile life in the camp really was. Sometimes I have been to travel to a near city in South Sudan just to access to internet to find like bring donations or something like that, to bring some food and also to bring essential drugs to treat people. Lessons and reflections. From this experience, I have learned several important lessons. First, humanity must always come first. No child or civilian should suffer simply because of war. Second, the camps reveal the true human cost of conflict, not only physical illness, but also deep psychological and social wounds. The third, peace is priceless. Only who have lived there truly understand it is a value. And finally, I learned the power of resilience and sacrifice and community. People can come together even in the darkest of time. Next, please. So, as I conclude my presentation, I want to make a call of actions. We must support displacement people in Darfur, in Al-Fashir, which is now, it's been for more than 2 years. There are no food, there are no materials, there are no medicine can come for these people because of the conflict there. And there is others area in Sudan, which is struggle from that problem. There are no food and also there are no medicine and shelters and essential healthcare. We must strengthen the primary health system inside the camps and integrate mental health, which is very important. As I said to you previously, there is here in Uganda, in Kampala, a refugee camp, from the start of the war till now, more than 10 young people, unfortunately, has succeeded to end their life by very tragic and very sad way through suicide. And I hope humanitarian actors, both local and international level, must be coordinates more effectively to prevent collapse. Every effort matters, and every life saved is a step. Thank you. I want to say that all the pictures from my story and this presentation actually bring for me like a very, very sad memory. And thank you.
Thank you, Dr. Mujahid. Thank you for sharing with us your experience. Like actually, Dr. Mujahid, we will live with him every day. What he is doing in the camp, he was sharing the stories, the story of the kids, of the women who treated, he's struggling with collecting to money, how the kitchen today is closed because there is no money. And then the other Sudanese started to raise and send him money so the kitchen can be open again and they can make food for the people. So we were living with him every day through like social media, which was really good because he was reflecting the life there. So thank you, Dr. Mujahid. Now we will move to another young woman that they are doing a great work in helping the Sudanese people, especially in the health sector. So we will go to Dr. Abrar Ralim. So Dr. Abrar is a Sudanese physician, public health specialist, educator, and international leader, humanitarian leader. She graduated from Al-Ahfad University of Women in 2020. She is the president of the Sustainable Development Response Organizations, a nonprofit dedicated to building sustainable and resilient community in Sudan. She also served as assistant director of the training development of the training development of the training and development department at the Sudan Medical Specializing Board, where she leads continued professional development and health education program. During this war in Sudan, Dr. Alim and her team at the Sustainable Development Response Organizations have been at the front line of the humanitarian response. They have partnered with the WHO, National Ministry of Health, and international organizations to secure access to primary health care for vulnerable population. Through the Sudan ECHO Center of Excellence, the Sustainable Development Response Organizations have implemented more than 6 emergency capacity strength programs. And recently, she was admitted to both the University of Oxford and Johns Hopkins University to further her studies in population health. So, Dr. Abrar, the floor is yours.
Hi everyone, hi Mala. Am I audible?
Yes.
Can you hear me well?
Yes,
Okay,
we
thank
can
you.
hear you. You can start.
Okay. Thank you so much and hi everyone. I hope that you're doing great and thank you so much for making the time to come and listen to our stories. And we hope that we will inspire you and we hope that this would add to all the humanitarian action that is now happening in Sudan. And thanks for Pax for the invitation and for making the room for me today to speak about Sudan and what's happening and what we're doing there. So before I start my presentation, I would like to declare that we have no conflict of interest in this presentation and we obtain permissions before using the pictures that you're going to see. So thanks to Marwa and Mujahid, they make my life so easy after what they have reflected about the worst humanitarian crisis in the world that is now taking place in Sudan. So I'll be focusing mainly on the health needs and I will just give a quick background about Sudan before the war. So if you looked at Sudan before the war, the crisis and the humanitarian need is not something unique to our context. However, things they got escalated because if we had a look backward, we will find that Sudan was facing many political instabilities, a long history actually of political instabilities, recurrent waves of displacements, especially across the borders or near the borders, if we looked at Darfur, and also we have waves of displacement inward inside Sudan. We have many refugees camps, especially at the eastern side, where we're facing major waves of floods and natural disasters almost annually. And also, if you looked at the health infrastructure, it's very weak and almost collapsed, and also centralized in certain areas around Sudan. So not all the people they had access to healthcare services across the country. So this has been the situation before the war for a long time, and then after the war, things they became even worse. Out of a sudden, we faced like one of the worst hunger crisis around the globe, and also we had a major educational backlash, as Mawa has mentioned, and many people right now they are facing violations and they are living in very insecure conditions, even if they are not displaced, especially women and girls, and also the dynamics of the health. Phenomena they have shifted during the past period, especially that we had major outbreaks across Sudan that we didn't used to see before. We used to have like endemic areas and we used to have outbreaks in certain regions, but now we're facing waves of variety of outbreaks, including dengue, cholera, and so in places that we didn't used to have such outbreaks in. And also people are lacking access to basic services like access to clean water and sanitation, and has been a major impact for many women and girls across Sudan, and also the hunger and the famine that right now we're facing. So if I would like to put numbers into that, as of our talk right now, we have more than 11 million people displaced, and we have more than 26 million people who are facing acute hunger. We have more than 6.7 million people at risk of GBV, whether regardless of their gender. And also we have more than 4 million women and girls at a reproductive age that they need urgent reproductive care. And we have more than 19 million children that are out of schools. And if we looked at Sudan's population, basically we're 47.5 million, and now we have more than 64% of the total population, they are in urgent humanitarian need. So the whole country is falling apart, obviously. And if you looked at the impact on the health sector specifically, we will find that we have more than 20 million in urgent health need. And thanks to my colleague Mujahid, he has already reflected how is it actually going from a personal experience in refugee camps. And also we have more than 70% of the health facilities across the country, they are unfunctional. And as I have mentioned that we used to have a centralization issue in Sudan where all the services were condensed and were focused in one area, which is Khartoum. And many of the states, they used to operate with one hospital that could consider to be a rural hospital, dispensary, or a PHC center. And many people, they were out of the health system covering at all. And the outbreaks that are now taking place in Sudan, they vary from cholera, measles, we have the malaria, and the recent one, the wave of the dengue fever. And beside that, the lack of the emergency and trauma care, which is very crucial since we're still in an active war, we have active war zones, and also there are major attacks on the healthcare providers themselves, which is a real challenge for them to provide and to support the crisis and the people of Sudan. So after looking at the situation and how difficult it is, we wanted to have another, side and to look at what can we do to minimize the damage. And this is the part where I'm going to reflect the experience that we had in Sudro and what we're doing right now in the ground to support the Sudanese people and to minimize the damage of this crisis. So SUDRO, it stands for the Sustainable Development Response Organization, which is a non-profit organization that we have established just with the goal of building sustainable communities to respond to humanitarian needs and also to have sustainable actions out of this response while we are in a sincere partnership with the communities to exchange knowledge and also to build the capacity of the Sudanese people and those who are coming from similar settings. So the organization is mainly operates through youth volunteering, and it's an initiative that we have established by the volunteers themselves with the support of mentors and Sudanese diaspora, mainly from the US. And right now we only operate in Sudan, and we have a sister organization at the United States where we have all the consultations and the mentorship usually take place. So after the war, immediately we came with what we call it the Sudan Emergency Response Program. It's a program that we have established as a comprehensive approach to help mitigate the healthcare shortage crisis in Sudan. And it was a very rapid response, like on the same month when the war started, we came with the idea and we started to mitigate and to intervene. So our scope of work, it's mainly training and capacity building. And this is, we try to do it for the frontliners and the volunteers and all our partners and those who are interested. It's an open programs that we usually target different groups, as I mentioned, through them. And also the provision of primary healthcare services. And this is where we have the community medical response team. It's our first initiative that we established at the time of the COVID-19. And then after that, we established the organization and we continue the work until day. So we usually try to train, capacitate, and then we try to deliver the service accordingly. So our methodology for the program or the framework of that program simply was we identified different areas and different humanitarian needs, and then we pointed our strengths and mainly we focused on healthcare services delivery. And the PHC was the approach and was the model that we know it's going to work. And it's the best one to suit the background that we have in Sudan when we look at the health system itself. And also we had a special focus on the SRH and GBV. And the approach was through mobile or fixed clinics. And we have the mobile clinics and the fixed clinics operating at 13 states across Sudan, including Darfur and Khartoum. So through these clinics, we were looking forward and we were looking to prevent and control seasonal diseases and chronic cases also, and also to have some kind of health promotion activities so we can support with community engagement and to make some kind of sustainable approaches for the community so they can help themselves along the journey. And also to provide resource and capacity building, as I said, for the frontliners. And this was the first activity that we did through the program. So we started on April 2023, and the program is still going. We started with what we call the emergency echo with the WHO IMRO, and we had like 43 sessions where we covered different topics, and we had a curriculum that were tailored to the ground needs. We used to receive the inputs from those who are in the ground, and then we designed the program and the sessions accordingly. And we covered programs, sessions, I mean, that covering different anticipated humanitarian crises at that time, like malnutrition, the GBV, and so on. And then we had separate programs mainly focusing on emergency response, SRH and GBV, mental health, outbreak response, and so on. And we managed to have a platform where we have more than 17 health providers, 17,000 health providers there, and we will try to deliver the courses and the programs for them before we plan for any kind of response. And since we started with the limited funding and with the volunteer effort, we've managed to reach more than 60,000 patients, and we had many local gaps were identified. And the unique element about this program is that it was tailored to the local need. So if you looked at any data right now from Sudan and possible interventions that we can do, you will find that most of the people they are talking about the macro level, the needs at the macro level. However, the specific local needs, most of the times they are not addressed. And if you have like a strong background about Sudan, you will understand that the population dynamics and the social dynamics as well, they do affect the availability of the local context at the macro level. So we worked at the micro level to identify the gaps, and then we tried to respond accordingly. And we had special group campaigns where we distributed dignity kits for women and girls, and we had sessions and group settings, and we tried to identify their needs based on the local situation, as I mentioned. And we were lucky to reach them at their places in different locations, including border camps like in Adri, Chad. And this effort was not done only by our, by our individual instinct. However, we had many partners who came with us together through this journey, and it has been amazing the amount of support and the availability that they have brought to the table. And this has made us realize that it's all about collaborative effort, as Mujahid has mentioned earlier. So this is one of, these are pictures from our recent campaigns. This is in North Kordofan. We had a clinic last month, and we have one that is going to happen this month and in the 2 following months. And this is one of the pediatric clinics, and one of the major issues that we have identified in North Kordofan as well was the malnutrition, as we all know, and across different groups, not only across kids, but also elderly, women, and even youth. And also we had the privilege to collaborate with SEHA to deliver a midwifery training for midwives in northern state and also in the Red Sea state to act as a local respondents where it's needed in their villages. And as I mentioned, we have distributed dignity kits, and so just to support the situation in different camps. So if we looked at the dynamics within our organization as well, you will find that we have all these outcomes of the programs that we're running are actually taken care of by displaced, insecure volunteers that we consider them as young heroes because they are facing the atrocities of the war. However, they decided also to continue and not to take a side. And they are facing constant challenges. And the challenge is additional to what Mujahid has already mentioned, that for us as an organization or a youth group, we're constantly facing the funding issue beside the questioning. We know that for the international community, many of them, they have the interest to join the efforts that are happening in Sudan, but the accountability based on the background of the system and the long history of the actors, international actors in Sudan, has made it a little bit challenging for youth groups to just respond without many questioning, without the accountability confirmation. And so, and maybe in the upcoming talk, you will have a background, better background through the ERR work and the challenges that they are facing. So these are part of the challenges that we're facing. I have added them to what Mujahid has mentioned, as I said. However, we're not taking a side still, and our young heroes are always present and they are willing to serve whenever it's possible.
Hello.
So this is led us to call like for coming together. We would like to come together, and in Sudan we have what we call it Nafir, and Nafir simply it's coming together. So there is willingness in the Sudanese people to help themselves and also to find a way of coming together if all the means they were available. And this picture from one of the neighborhoods in Khartoum where people are facing the hunger. However, all the women, they gathered their effort together and they tried their best just to organize meals for the neighborhood and for those who couldn't leave the war zones into safer places and just to manage along the way. And Mujahid has already mentioned that, and Mawa also has highlighted the kitchens that they usually do in the camps and the Nafir effort. So Nafir is a basic concept that we have it in our blog, and it's a good chance for people to come together and to act together in order to end the humanitarian crisis in Sudan if possible. And this, I'm reaching the end of my presentation, and I was really inspired by Abla and her presentation from the previous session, the one that was talking about the women in Sudan. And this is really inspiring because, as you can see, كل نهاية تكون بداية, every end is a beginning. This is summarizes what we do call for, that we still have hopes and we still have the youth, and their energy is a powerful asset, as we believe. And our experience, Mujahid experience, and other people who couldn't join us today, it's the proof that there is a chance to have a better outcome. And whenever this war is ended, then definitely there is a way of sustainability because of the resilience that we have witnessed during this war and until now. So we usually say that in Sudro, if you have the people, then you are resourceful and you have all the resources that you need in order to respond. So this is how we envision ourselves, and this is how we envision other groups, and this is what we have been listened to from the people whom we served recently. So we do believe that empower communities, they mean sustainable future, and this is the essence of our work. And feel free to reach out to us through any of the means, and also to visit our website to see and to know more about our work and what we're doing in Sudan with our partners. And thank you so much. Keep eyes on Sudan and pray for the children of El Fashir and the poor. And we hope that our presentation today give you some kind of a reflection and give you hope or inspiration of what we can do together in order to help the people of Sudan and to end the silence about Sudan. Thank you so much, and over to you, Mama.
Thank you, Dr. Brar. Thank you for this amazing presentation, and thank you for showing us what Cedru do. This is what we need to show the hope for the Sudanese people, to show also that they are not left alone. There is a huge amount of work they are doing to help all the Sudanese people, especially the people in the Fashir who are facing acute hunger, who they are facing a blockage of food. They even the RSF, they are want to build a wall to block the food from the Fashir in the Fashir city and that area. These people, when they hear our story, when they hear this kind of work, they will not gonna feel that they've been left alone. They will feel that some people are fighting for them and some people want to help them. And one also, like Abrar mentioned, what the youth are doing. This is what we're gonna learn now from the emergency room from Saleh. So I want to introduce Saleh to you. Saleh is a young researcher and activist engaged in issues of democratic transitions and political development in Sudan. His work focuses on grassroots mobilizations, political economy, and civil-military relations. He is affiliated with the Sudanese Center for Policy Studies, which bring together a group of academic, political actors involved up in December revolutions. Saleh has also many publications in Arabic and in English, sharing the experience of the emergency room and what and reflects the revolution and what's happening in Sudan. So also, if you want to learn more about Saleh's work, you can go and visit his paper. So Saleh, the floor is yours, and I will share your seminar. Okay. Sorry, just a second. Okay. Sorry, just a second. Yeah, sorry. Yeah, it's working. Okay. Okay. I cannot go up. Okay, there's I think I'm facing them. That's strange. Okay. I'm facing some difficulties, yes. Okay. I don't know if Julia can.
Yes, give me one second.
Okay, it's better. My phone. Also, I want to remember if you have questions, please put your question for the speakers in the Q&A box, so that our speakers at the end they can answer all of your questions.
Hello everyone. My voice is clear? Julia, Mawa?
Yes.
Okay. Next page. Okay. Next page, please. Hello everyone. I'm very glad to have this opportunity to speak about such an important topic in this webinar. Let me start by introducing the main concept behind today's talk. Actually, I want to introduce the idea of emergency response law in Sudan. This initiative are not just quick reaction, but a response to one of the most complex humanitarian crises since the war started in April 2023. With the collapse of the state institution and the failure of basic service, millions of civilians were left dangerous conditions. While official system and international organizations struggled to reach people, emergency response room appeared as stories of survival, adaptation, and resilience. They show the ability of community to protect themselves when the state disappears. And to understand this, we first need to go back to the background. Actually, after the December 2018 revolution, the resistance committees became a hybrid pillar combining both political and service roles during the transitional period. They balanced between sorry, they balanced between organizing political activity and providing community service. But after the October 2021 coup, they once again focused primarily on revolutionary action. But with the outbreak of war in April 2023, the situation changed completely. There was no longer any space for political action. And at the same time, humanitarian needs grow massively. due to service collapse and withdrawal of many formal and international actors. In this context, grassroots network created a new model. This model it was the emergency response room, which became organized hub for relief and support. The rise of emergency response room clearly shows the agile response of grassroots structure in Sudan and their ability to adapt quickly to extreme change. In many towns and neighborhoods, emergency response room become the main humanitarian lifeline. Next, Julia. Uh, now they now Now that we have the background, let's look at what emergency response rooms really are. Emergency response rooms are informal grassroots coordination network led by volunteers, often using digital platforms like WhatsApp, Telegram. Their role is to respond to urgent community needs. Running Takaya is community kitchen, distributing food and water, providing temporary shelter, and documenting violence. Even so, they are not formal institution or emergency response room become a vital defense line for civilian survival. They are not permanent organization, but temporary emergency structure born out of war. Next. Now, having defined emergency response room, the next question is why did it the emergency response room actually emerge? Uh, Emergency response room appeared because the state collapse of many international NGOs reduced or stopped their work, community faced urgent needs. So they revived Sudanese tradition to Nafir. Mujahid and Abrar mentioned on this concept, means collective help, and combining it with modern digital tools, this mix of culture, solidarity, and technology turned emergency response room into flexible and fast humanitarian response, showing the strength of grassroots adaptation in times of crisis. Moreover, emergency response room spread very quickly after the war started. This fast growth was possible because the institutional legacy of previous grassroots structure in Sudan, especially at the resistance committees, actually. Community had already had a network of trust, experience, and organizing, and the legacy of traditional collective help, which helped them build emergency response room in short time. An important point is that emergency response room, we are not limited to conflict zone. They also appear in safe state and they played a major role in helping displaced people. The next. And now I will talk about interaction with international actors. The relationship with the international community can be seen in two levels. As the first, on the field level, some humanitarian agencies recognized emergency response room as important local partners, but support was limited because of strict funding rules and security concerns. As a second, on the political and diplomatical level. Many actors misunderstood emergency response room, saying them as normal civil society organization, while in fact they are temporary emergency institutions created under war with a strong overlap with resistance committees. Because of misunderstanding, emergency response room often fills a gap left by slow or limited international aid. Next, Julia. Now I will focus on the key dynamics of the emergency response role because they show both their main strengths and the challenges they face. The emergency response room have a many strengths point. They have strong community trust and fast action and deep network with youth and women group and the support. As for the challenges, volunteer targeted by armed group, shortage of medicine supply, internet codes blocking communication, and weak accountability structure because of their informal nature. This makes emergency response room strong and fragile at the same time, powerful in community response but limited by resource and risk. So emergency response room also have strong social legitimacy that came from the trust of local community, not from legal recognition by the state or donor. This puts them at risk to being sidelined or misunderstood by international actors. Volunteers also work in very risk environments where they may be targeted by armed group or accused of taking side. Despite this, the emergency response room have tried hard to avoid direct politicization, keeping their focus on their humanitarian rules as a system of mutual aid. At the same time, they also tried to create simple mechanism for transparency and accountability to strengthen community trust and support their ability to continue. Actually, next. Uh, to conclude, I would like to highlight the main lesson we can take from this experience of emergency response room. The experience of emergency response room in Sudan is more than a local humanitarian response. It's a global example of peaceful grassroots organizing in the middle of a state collapse and brutal war. These rooms saved the life of hundreds of thousands through solidarity and innovation. For this reason, the Oslo Peace Research Institute nominated them again for the Nobel Peace Prize, showing international recognition of their unique role as one of the most inspiring models of community peace during war. During war. At the same time, the experience of emergency response room shows that humanitarian response is not only the job of government or international agencies. It can also come from community themselves. The future of emergency response room depends on whether international actors can understand their temporary and emergency nature and not confuse them with permanent NGOs. Recognizing and supporting this role is key for building better recovery strategies and for valuing the leadership of Sudanese community in shaping the country's future. Thank you. Thank you.
Thank you, Tara. Thank you for your presentation. And we hope this year the emergency room will get the Nobel Prize, not just for the recognition for the work and what they are doing on the land of helping the thousands and many people, also because the money that they're gonna get, it's gonna help 1 million of the Sudanese people who are in need for aid, which is really is gonna be really good for the Sudanese people. Also, I remind if anyone has a question, please write it in the Q&A question. So to show you the work of the Sudanese youth and what they are doing on the land, I want to share with you an experience of just one Sudanese. This guy, his name is Mushtaba. He started a small initiative. He was walking across the University of Khartoum, one of the greatest and well-known university in Sudan. He found how the war destructed the university. So he started to clean the university, to rebuild it. And over every day, more and more young people started to join him. This is a story of just one guy, a young guy in Sudan who want to rebuild Sudan. And there is also many other women who are doing the same by helping other women, give them psychological support, trying to survive, trying to make their voice being heard in the political part. So including youth, including women in our peace initiative in the next Sudan is important. What I like to call as the situation in Sudan, and especially what happened in Darfur, it's like a phoenix. They are raises from ashes. They are giving hope, and with hope we build future. So they use the youth, the women, and everyone that there in Sudan. They are rebuilding a new Sudan with the voices of the youth. So here I don't want to say more. We can go to a Q&A questions, and I will leave the floor to Julia and the other speakers.
Hello, here I am. For those of you that don't know me, I'm Julia Bordia, I'm the Advocacy Officer for Pax Christi International. I thank you, Mawa, for passing the word. And thank you to all the speakers. I will now give me just a few minutes that I will add all our speakers in the spotlight so we can focus on the panel. We got a few questions. I have also some, but in the meantime that I'm asking those, if some of the people that are joining us in the webinar wants to ask their questions, you have the Q&A button below the Zoom screen, and you can type your question there, and we're gonna try to answer your questions. So first of all, a huge thank you. I mean, I took so many notes and there is a lot that in those 15 minutes each you were able to say and share. So thank you very much. I will start from the questions we received actually. I think probably this is a very open and broad question that I think pretty much all of you can answer to it. So I will just open the floor, and then if one of you want to answer first, or you just want to answer, you can just start talking. It's open. So we have a comment and a question from Jenny that she says, first of all, I'm in awe of the way Sudanese people are persisting, serving and sustaining each other during this difficult time. Thank you for your creative, persevering care for the health and well-being of your neighbors. May we all from you. God bless you. And then the question is, can you comment about the humanitarian condition in cities under siege, El Fashir, Dilling? In addition, and then the next question, and maybe I will ask it in case you can link it to it. In addition to our donation for grassroots emergency response, are there other things that non-Sudanese people can do to promote an end to this conflict and humanitarian access for cities and under siege? So there are two questions, and I think you can also find a way to link the two. So the floor is open. Sobra, Majed, Saleh, if you want to answer. You're muted, Saleh. Wait. Oh, I can ask to mute, so maybe you should receive a notification. Okay.
Very well.
It works now. Yes. Can you hear us? No. So I see Abrar has her hand up, so if you want to go first, and in the meantime, we fix the audio issue.
Okay, thank you so much. My answer might cover part of the question. So if we looked at the situation right now in El Fasher, it could be the most severe one compared to other locations because of the complete lockdown, and also the ongoing attacks on the civilians. And the civilians are the ones who are actually paying all the price of this chaos that is now happening. And right now, people, they started to eat the food that they used to feed their animals with. They started to eat the leaves of the trees, which used to be unedible for them. And this has been documented across different media platforms, and there are many reports about it. However, the actions and the humanitarian response to that also is critical because, as we mentioned, many attacks, they were directed towards the respondents, whether they were local or national or even international, and also severe damage to the health infrastructures and the facilities there. It has been encountered. So it's a little bit difficult for the people there just to have some sort of a stable response. However, many local actors and initiatives are still there, and they're willing to support whenever there are any kind of means. And I think at this point, and maybe Saleh, he can elaborate here, we need the global attention towards what's happening in Al-Fashir, like the pressure and highlighting the issue of Al-Fashir would definitely give some kind of hope, or maybe give some kind of chance, because at the end of the day, if we looked at this war, it could be a civilian war, yes, but there are many external hands jumping and actually supporting the situation, this very brutal situation right now in Sudan. So talking about the problem, talking about the issue, and bringing more attention to what's happening in Al Fashir. And also, some people, they do manage, because if you look at our map, it's an open border. So some people, they manage to escape, and they do have their ways to escape. So in adjacent cities, maybe if we can provide some kind of means and support and shelter for them, that will be great. And this has been happening right now in the northern state. They have been receiving refugees and, let's say, in displaced people from Al Fashir. So if we can support the actions there also, that would make some kind of a difference.
Thank you, Abrar. Our other speakers want to answer to this question, otherwise I go to the next one.
Julia, I think Saleh.
Yeah,
Saleh, are you speaking?
I'm trying.
Because you're muted.
Okay.
Yes.
What's the question?
The question is, you can find it in our chat also. If you can comment about the humanitarian condition in cities under siege, it's the first question. And the second one is related to the
Emergency
donation.
response room. Okay.
No. This is the next question that I will ask you, so don't spoil it yet. The other question is about support that non-Sudanese people can do in order to promote an end to the conflict.
Okay.
If not, I can go to the next one.
I prefer to answer about next question.
Okay, perfect. Okay, I will ask the next question, and it's related indeed to the emergency response room. So the question comes from Ronald asking, are ERRs participating in any civilian political processes, or are they just focusing on humanitarian work?
Actually, they don't, the emergency response room, they don't participate in any political activity now to service a sensitive role in the humanitarian work in conflict area and conflict zone in this world. So they don't to participate in any political activity now. But the future, yeah, with you that the emergency response room will until established as a grassroots initiative to meet urgent humanitarian needs during the war. So the situation now changed completely, and has no longer any space for political action or political actor in this time.
Thank you very much. Then we have a question actually that is very interesting, and I think Moshad touched upon this while he was expressing the difficulties had in reaching and gathering aid. So Charles is asking to comment on the state of existing infrastructure such as roads, airport, and ways of getting humanitarian aid to those in need.
Unfortunately, currently in Sudan, fortunately, there is some hope because like their airport of Khartoum now nearly it will start working, and that can provide humanitarian aid for those people, even that area was being have conflict like Al Jazeera with Medani, and also Sinnar, White Nile, and Al Ubayyid. There is many cities in north and western have been or going with the conflicts, but now the rebuilding life it's going on, and also there is this, life also there is some facilities like electricity. It has been retired in many cities, and but the challenge is there is no basic needs for like drugs, medicine, as the outbreak of disease, and people over 18 states in Sudan, they have a difficulties in shortage of medicals and something like that. But I guess the opening of Khartoum airports and Port Sudan, it will bring a hope for delivering humanitarian aid for Sudanese people.
Thank you very much. I'm just going through the questions. Yeah, we touched upon already with Mao about the youth, but I was wondering if you could add something more about it, like how much actually young people are involved in all these actions that you have been describing and presented, and their indeed added value in providing aid. So this is an open question to all of you, actually. I mean, you are also already young, so that's already like a representation of it, but yeah. Mawa, yes, you can jump in. I cannot do as well.
Okay. The youth work more on the peace because this is what they can offer now. They cannot be involved more than or give more an effort because they had been attacked. Like a lot of activists, young women, especially women, they had been attacked from the two parties, from not showing the truth or what happening actually in Sudan. So many of them, they are trying the best that they can to fix and to rebuild the country. So this is what we can give the youth to help other people, to help Sudan that we need. But a lot of them had been attacked by the two parties, which is really sad about what's happening in Sudan. So this is what we can offer. That's why we focus on the symptoms and not like a solution, because we will try to direct our effort with the thing and resources that we have.
Thank you, Mawa. Abrar?
Thank you, Mao. I'll add to that. It's not just the idea of not having the space, but at some point it's about creating the space for youth. Because if we looked at our own experience at Sudro, and if you looked at Sudan, the majority of the population are youth, are either children or youth. So eventually, they need to be part of the system. They need to be represented at some point. They need to be here, and also they need to be capacitated. So one of the successful models that I mentioned earlier in the presentation that we use is to build the capacity of the youth. So whenever they are engaged in any of the conversations, they won't feel they are excluded or they don't have the experience to express maybe their needs or even to reflect on the Sudanese nation needs. So this is what we try to do. Maybe we're working in a specific field, so maybe things might be a little bit different compared to other fields. However, we did try that model and actually it worked because we involved many people in activism in a direct and indirect way, responding to the gender-based violence or GBV, to the SRH needs, as it could be a taboo topic and it's not easy to engage the community and the elder group into the conversation. And also for the local authorities, we had major challenges with the authorities when it comes to border area like North Kordofan and other areas. However, we managed through the capacity building activities and through the examples that we did earlier, we managed to have some kind of connections and sometimes of advocacy efforts with them. And also the partners, they have helped in that. That's why we're calling for coming together so the youth can be supported and they can have some kind of a backbone so they can move forward for their agenda. So maybe if we try this model in another areas and in a bigger scale, it might work and help out. I'm just trying to be positive.
Yes. Yeah, we need that, I think, to
Yeah.
keep that kind of spirit up, because otherwise, yes, the other way is not nice. So thank you very much. We actually have also an additional question, and please, Saleh, your hand is raised, so I gather you want to speak. No. Oh, yes.
Hello, Julia.
Yes.
I would like a brief about the situation in Fasher now. The situation in big side cities like Fasher, it's very It's very difficult, extremely difficult. Resistance facing severe shortage of food and basic service. Actually, your donation to support emergency response are very helpful, but for a long time, the solution, international pressure on the RSF militias to end it left the side and ensure safe humanitarian access. So, situation in Al-Fashir very complicated and very different about any conflict zone area in Sudan now. So uh, we need international pressure to this. Thank you.
Thank you very much. Yes, definitely that's something that also with this webinar we would like to try to achieve, to gather all the support we can. Then this last, maybe once to last question, then I have a last question for you all. So this question comes from Kizito, and the question is, South Kordofan and Blue Nile communities have faced marginalization for decades since the 60s, and why are we always not including them in the discussion? Please, if you feel comfortable and prepared in answering, feel free to answer. Otherwise, yes. Yes, Abrar.
Thank you so much. I don't think like when it comes to us and when it comes to me and when I look at my experience in Sudru, um, I won't feel like there is someone who's excluded from the conversation for us, honestly. Like we're a big group of youth. Maybe we're more than 300 volunteers. We came together from different regions across Sudan, from the south, from the north, and we don't have like we don't talk about segregation or regions, but we talk about the need and the delivery, regardless of the place that we're currently in. And all the state teams, the 13 states that we're serving in right now, um, they have their people decided to be part of this network and then to respond. So this is one thing that helped. And those people, after they have been displaced from some locations, they served equally and they showed the initiative to join other teams in other states as well. So we have some team members from El Fasher, from Darfur. They served in Kassala after they have been displaced to Kassala. They served in the northern state. Now they are serving in Khartoum. And when we go to the south as well, they are serving. Some locations, they have their complexity. Maybe we couldn't find a team member there to lead the initiative. And other people, they have been attacked. And most of our teams in this location, they have been displaced. So we have many people who they had to go to Chad to find the refuge there. So we tried just to address like the situation from our side. But I don't think at this point in Sudan there is someone who can be excluded from the conversation. Like not for Mawa, for Mujahid, Salih, and all of us together here, if I may speak on their behalf, they would have felt like there is a community that should not be included in this conversation. And some of us, maybe they have their roots and their backgrounds actually coming from that side, as Mujahid mentioned. He's from Sinja. He has family in the Blue Nile States, me as well. So I'm not defending. However, I just want to put this as maybe a foundation for such a conversation that right now, none of us could be excluded from the conversation when we talk about Sudan, whether that person is inside Sudan or even outside Sudan. Because all of us, we have faced the atrocities and we're still facing them. And if it's not ourselves, but our friends, our family members, and our root, our roots there. So yeah, and definitely we would love to hear more from people who are representing these places as well. And feel free to reach out to us. So maybe we can have a team there if we're not already serving there. So yeah, no one is excluded from this conversation at all. Since you're Sudanese, you're part of it.
Thank you, Abrar. Thank you very much, Mawa.
I want to thank Abrar for highlighting this, that no one is excluded maybe it was happened in the past. Some of the regions felt that they've been left alone to suffer alone, especially the people of Darfur, Kordofan, and so on. But now to have more cooperation, collective effort, and so on, we have to talk about collectivism. We shouldn't have to talk about individualism. We have to bring all of us together without whatever your background, your ethnic group. So because of Sudan, what we think about it, the different ethnicity was causing many problems. So we have to leave this behind and come together. So no regions will be left. We Kordofan, every other region, they are always in the mind. They are always in our talk. So no one will be left alone. And thank you, Abrar, for highlighting all of that. You put it amazingly.
Thank you, Marwa. Saleh?
Okay, my voice is clear.
Yes.
I think the situation is more complex than the idea of possible political participant. Currently, there no space for political activity inside Sudan with the war. So the situation is very complicated now in Sudan. So just I don't think.
Thank you very much. Yes. I have one last question before giving the word to Marta Inés for all our panelists. So just brace yourselves. You shared a lot, your personal stories, but also if you didn't share like personal stories, your personal story came out from what you shared. And indeed, you endured and you're still enduring a lot. I think not only from the professional side, but also on the personal side. So I have a question for you. Feel free to answer as you wish. And my question is about your motivation. So what keeps you, meaning alive in the sense, alive in the work you are doing, in the efforts you are putting? What brings you the motivation, the light to be there every day and to constantly be there every day?
I think the motivation behind this work, the struggles of our people there, for me, especially when I was being in the camp, I see many child, they need help, many pregnant women, children, they don't have a tent, and they facing the falls, and they facing also when in the winter and when it's sunny without anything, and people they're facing famine, children crying. And when I feel like even when I feel tired, just I see my impact. When outbreaks come, like many cholera, for example, there is hundreds of people in front of my clinics in the camp. They're waiting my service. I see my impact. Even I feel tired. I feel depressed. But if I am not moved because I'm the only one, for example, like I have tools that I can communicate with others. I can reflect the situation there. I can bring, for example, donations to support those people with food. If, for example, one day, if I'm not cross a long distance, more than 2 hours on walking when it's rain, the thousands of children, the thousands of individuals, they cannot get food for the day because there are no money. The majority of them, and also the area is conflict zone. Even the food is very expensive, and even medicine. If I'm not going there, if I am tired or whatever psychological situation that I have, the thousands or hundreds of people, maybe the children for all day they cannot get a one meal in a day. When I do that, I feel like my work, my move, it's make a huge impact through the health services, or even through when I provide the shelter for one family and I see like a woman and child, they cry because all night they cannot sleep because it's rain. Or I give them a food because they are like more than 20 hours, they don't find anything to eat. when just I do that through the central kitchen or provide a shelter or prescribe some medicine that can relieve their pains or like make them survive, which is huge motivation of me. But as you see, that's definitely it reflects in my experience. It reflects on, even on my psychological, on my perspective. But when I see that, I feel highly motivated. Thank you.
Thank you, Mushahed. Abrar, Salhi, want to share?
May I jump in?
Definitely, yes.
Okay, thank you. Um, so if I wanted to reflect on my motivation and our motivation, it can simply be reflected through that people matters. And when you try to live that situation and then you get lucky enough to get out of it, then you will know that this is something that happened to you because there is something that you need to give at some point, because we're all survivors. Like the way I left my home with my family and the amount of fear that I felt on that day, I haven't experienced before in my life. And I know that all the people who are trapped and they couldn't get out of it, they have experienced like maybe way more intense emotions compared to mine. And also, maybe this is something that can be genuine because our community and our community culture is so open. So this is something that is maybe rooted in us as a community, that we try to help each other. We always extend hand with our neighbors, and so to have someone taking an initiative in Sudan or mobilizing the others is not something that is strange or unique. But the greatest motivation is that when you see people's life really change when you do the action. And this is what exactly we have experienced through our organization and my team of volunteers. We intervened with many, with very minimal resources, but the impact was huge. Like one time we got funding, and the target for that funding was not even reaching 1,000 patients. However, we managed to see more than 7,000 patients with that funding, while the actual benchmark and the limit was 1,000. And right now we're doing a project where the target is 2,300 patients. And actually, we have reached that target through our first round of clinics, and we still have 3 months of clinics to go to. So this is all, it's proving that we're doing is right, and we have the capacity and the capabilities, and that everyone is really matters. And whenever we move the stone, then we usually have a step forward. So this is what really keeping the wheel running. And also for the future of the Sudanese people, like we're young, we want to see a peaceful Sudan. We want to have the luxury of living in our country in peace, and just to build it up and together with our families, with our friends, and also for the future generations, so they won't feel disappointed, honestly, because we know what we built today definitely is going to pay off in the future. So this is what we hope to see. And yeah, the wheel will go running. And also it gave us the chance to have you all together with us. And we haven't, expected that many people they would be interested in Sudan. So thank you so much for asking the question and for the opportunity.
Thank you, Abrar. Saleh?
Okay. Thank you, everyone. I hope we can come to the end of this war. It shows us how important community support and quick actions are in times of crisis. Emergency response room have a showing great dedication, protecting lives and easing suffering even the hardest condition. I'm deeply grateful to every volunteer and worker in these rooms. They have been a child role hope for affected community. The end of the war, of the war is the beginning of rebuilding, and the legacy of this emergency response role will remain in spring example of humanitarian and community work. Thank you, everyone. Thank you. I'm sorry, my voice is very weak.
No worries.
Try.
We likely understood everything you shared with us. So thank you very much. I will now give the floor to Martinez Romero. We didn't present her, she presented herself, but she's the Secretary General of Pax Christi International for her final words. And for all of you, question time is now over. If there are still pending questions, we will address them in written, but the chat is now open for you all in case you wish to share a few words of support, and in case you would like to support us and join in the next campaigns that we're going to launch after this webinar, you can sign in through the form and we will be in touch with you for more active advocacy efforts. So Martinez, the floor is yours.
Thank you very much, Julia. But most of that, thank you, Salih, Mugahed, Abrar, and Mawa for your inspiration. You have brought to us a word of hope, although this challenging situation. So thanks for this networking, Pax Christi International Working Group, composed by people of goodwill and compassionate and in solidarity of the Sudanese population, civil society organization. This has been possible to organize this webinar series, Sudan Speaks. It has been a privilege to have the Darfur Youth Center for Peace Development, the Sudanese Center for Policy Studies, and with these young people today, who has given us facts, but also methodologies implemented by them and their organizations. And some of these we see supported by international cooperation. We have listened also recommendations and ways to move forward on our capacity as international solidarity community with the Sudanese people, those in the diaspora and also in the country, to being in solidarity with you to overcome this humanitarian crisis. As I have said, you have brought today hope, although this challenging situation. So thank you and gracias. Coming from a country where Colombia, we have confronted huge violence and the displaced crisis, we understand well this situation. So I will present briefly some of the main conclusions coming from this webinar, just to have this remarked for the future action plan for the working group on Sudan. So the first, it is the idea of having a humanitarian crisis heavily affected by interests, foreign interests, internal interests that we have to witness them. So Sudan is suffering violence, causing a diaspora of migrants, refugees, internal displaced people suffering in many ways. And the humanitarian crisis, including man-made conflicts such as this forgotten crisis in Sudan, cause suffering and affect human dignity. And this humanitarian crisis should be tackled with integral measures. So I want to present briefly this because I think it is important to think about this contextual situation needs to think from now, as one of my main mentors, John Paul Lederach, says, we have to be prepared to design the future. So the basis for a transition process includes social cohesion, and social cohesion implies to empower communities, as you have said, participatory efficacy, collective efficacy, leadership, and effective leadership. So in terms of that situation, we identified three main issues: addressing immediate needs. So you have presented the need to life-saving supplies, healthcare services, shelter and protection, and the role of international cooperation in these urgent needs. But also the green one, it is preventing further crises by combating disease, those issues that are related to the malaria, the fever, the many situations, the nutritional support heavily affected by the reduction of funds, not only by the US administration, but also by the European Union, who has now these days the issue of the rearming Europe, and the local and global advocacy. And I think it is really important to listen to you, those who have presented the idea of I am in the field, I am with the people directly suffering. And the response of this situation comes from the community. And the third one, the blue, it is promoting stability and long-term solutions. So it is important in the future to support host communities when those displaced come back to their places, if possible. And of course, all the time from now, addressing the root causes, because sometimes we are suffering, attacking the fire and confronting this without and without having time to think about the future. And of course, the issue of protecting those more vulnerable. And when we are referring to strengthening capacities for social change, we are thinking about the way that we need to strengthening the local capacity in terms of abilities to tackle with the situation, but also the way to empower with some methodologies. At the same time, we are providing humanitarian assistance for them. And it is important to mark the issue of digital tools for creating a culture of peace and active nonviolence, and the role of local communities to care about the sense of belonging, to restore trust that it is heavily affected in conflictive situations and humanitarian crises like this, and to keep those ancestral solidarity expressions amongst communities. It's really important to those initiatives. And I think we have to continue in terms of strengthening the capacity to combine the local community, the strengthening capacities for them with the global. The advocacy, as Julia has said, our role with our consultative status towards the United Nations and the European Union, but also those regional bodies that we can confront with facts, with your recommendations, with your reflections. We continue being inspired for our work in solidarity with the Sudanese people. So thank you very much for your inputs, for your time, for your reflections, for your work, for your commitment. And we continue with the working group on Sudan, working very hard to tackle with this situation every day. Count on us. Thank you very much.